This video will show you how to take a throat swab. Start by washing your hands with soap and water. Dry your hands on a clean towel. Open the contents of the kit on a clean surface. Twist and pull the red cap off the plastic tube, but keep the swab inside the plastic tube for now. You will need a mirror to help see the back of your throat. While looking in the mirror, take the swab out of the plastic tube and hold it firmly around the red end of the swab. Slowly insert the soft tip to the back of your throat on either side of the uvula, the dangly bit. Gently rotate 5 to 10 times around the back of your throat. Try not to touch your tongue, teeth, or cheeks with the swab. Remove the swab and place it back into the plastic tube. Push the red cap in place until you feel it click securely. Wash and dry your hands again. Place the swab back into the cardboard box, write your details on the form inside the box lid, and use the addressed adhesive label to secure the lid closed. Drop your sample off in any Australia Post box. If you have not been contacted about your results within 2 weeks, please call Melbourne Sexual Health.